Conway, and this is my sterile wound dressing video for NUR310. I'm just going to begin by sanitizing my hands and introducing myself to the patient. Good morning, Mr. Moose. My name is Emily and I'm the student nurse here to assist with you today. How are you doing? Great. Can you tell me your name and your date of birth, please? Perfect, and that matches with the ID band. And I'm just going to begin. We're going to do a sterile dressing change today. Is that okay with you? Perfect, so I've received verbal consent from the patient. So I'm just going to begin. I have this garbage here ready for the old dressing, and I'm going to apply a blue pad below the wound. Perfect, and I'm just going to sanitize my hands once again and don a pair of clean gloves. So I'm just going to begin by removing the old dressing. So I'm just going to carefully remove the tape from the skin and pull back the dressing. I'm just going to take a look. So I can see that there is some drainage, but everything looks normal. So I'm just going to throw that into my garbage here. I'm going to take the opportunity to assess the wound. So I'm just going to take a look. There's a little bit of redness, but it doesn't look too bad. I'm not seeing any presence of edema or ecchymosis. The edges appear to be well approximated, and as we saw on the previous dressing, there is some serous drainage, but that's normal for this stage of the healing process, so that's good. I'm now going to remove my clean gloves into clean garbage, and I can get rid of this now. I'm just going to sanitize my hands once again. So I'm now going to prepare my sterile field. So I'm going to begin with the dressing tray. I'm just going to open that up. I'm going to use this bag as my garbage receptacle. Just going to place it here. I'm going to open the tray away from myself, being sure just to touch the outside border as the rest is sterile. Grab my forceps here and just adjust. Perfect. I am going to remove the extension of the sterile field, and again, just touching the edges. And when I place my forceps down, I'm going to make sure that they remain sterile and that the ends stay within the sterile field. I'm just going to apply that as an extension of the sterile field below the wound. Perfect, and now I'm going to add my supplies to the sterile field. So I'm going to begin with the syringe. So I'm just going to use the banana peel method, so open it up like this, grab my forceps, and add that in, pop it out. I'm going to use a blunt tip needle for irrigation, so again, banana peel method. I'm going to use a cotton swab to measure the wound. I'm just going to add that. Get that out. I will need a pair of scissors to cut the ribbon gauze, so I'll just open those up. And make sure that the ends stay on the outside as my hands will be touching them. And then I will need an abdominal pad for the end once the wound is clean. Just add that. And I'll need some gauze to cover it as well. To add some irrigation solution, so it's just some sodium chloride. So I'm just going to check the bottle, make sure that it's not expired, and then it's the right solution. That looks good. Just going to remove the cap. I'm going to pour quite a bit into my tray. Make sure to not go too close and touch the edges, but not too far that it splashes. Perfect. I'm just going to put a basin underneath the wound here to catch any irrigation solution. And now I'm going to add some ribbon gauze. I'm just going to hold it upside down, make sure that it doesn't touch the edges. And that should be enough. I'm just going to use my scissors to cut that and it will soak in the sodium chloride. Perfect. Okay, so I have everything I need. Just before I put on my sterile gloves, I am going to remove the packing that's already in the wound. So I'm just going to use my forceps for the last time. Remove that packing, throw it out, and also throw out the forceps. I'm going to open up my sterile gloves. Have those ready. I'm just going to do hand hygiene one last time just to be safe. And then I'm going to apply the sterile gloves. So I'm going to begin with my right hand. So I'm just going to grab it by the cuff. Make sure that I don't touch the inside. Just slip my hand in and pull the cuff down without touching the inside. And then I'm going to grab the other one with my right hand within the cuff and just place it in there, keeping my thumb away and pulling it right down. Perfect, so now I have my sterile gloves. So now I'm ready to irrigate the wound. So I'm just gonna grab the syringe. I'm gonna draw the irrigation solution, and then I'm gonna apply the blunt tip needle, take off the cap. So I'm gonna irrigate the wound, and I'm gonna start from the top down in a zigzag motion with even direct pressure. So I'm just gonna do that over and over until the irrigation solution is running clear. So I can see that it's running clear in my basin here, so that's perfect. Just gonna put the cap back on, put that there. Perfect, and now I need to measure the wound. So I am gonna use my cotton swab, and I'm just gonna measure the height. And I do have my ruler over here. That's measuring at about 10 centimeters. I'm gonna measure the width. It's measuring at about 2 centimeters. And then the depth at about 2 centimeters as well. And then I'm just gonna check for any undermining or tunneling. And there doesn't appear to be any there, so that's good. And I'm just gonna throw that out. Now I need to dry the wound, so I'm going to take my sterile forceps here, and I'm going to take a 4x4 and fold it up. I'm just going to dry the middle inside of the wound, right in there, make sure it's nice and dry. And then I'm going to throw that out. Then I'm going to take a few 2x2s, and I'm actually just going to clean the skin edges with some normal saline. Just gonna dip that in there. Just gonna clean the right side first from top to bottom, just one quick swipe. Throw that out. Another quick swipe on the left from top to bottom. Perfect. And now I need to dry that skin so that we don't leave it moist. So again, just gonna use some 2x2s for that. The right side, top to bottom. And the left side, top to bottom. Perfect, and now that's nice and dry. I'm now going to go ahead and pack the wound. So I'm going to take the ribbon gauze that we have soaking in the sodium chloride, and I'm just going to wrap it up like this. Perfect. And I'm just going to put that inside the wound, let it unravel, and just pack it nicely in there, not too tight, but enough that it's touching the edges and packing the wound properly. That looks good. Okay, and now I can remove my gloves. Actually, let's just cover the wound here with some gauze. Now I'll remove my gloves. Throw those out. perform hand hygiene. And now I can tape the abdominal pad on top, so I'm just going to lay that across there. And I'm going to take each edge to the skin. Perfect. And that looks good. So then I would just make sure that I throw out my needle here into the sharps container, and everything else can go into my garbage. I would make sure I document everything, so all the measurements and how the wound was looking, how the patient tolerated the change, and make sure that the patient is doing okay. And that brings us to the end of the video. Thank you.